My name's Alana Whitaker. I am a retired ICU nurse. I did that for 13 years. I now am a Web3 educator. I have two ed tech businesses. One is Digital Green Book, and the other is Blue Collar to the Blockchain. These are some of the concepts that I wanted to review with you today. Thank you for having me here at this conference. I wanted to cover a few different things that are happening in the blockchain and Web3 space, specifically as it relates to health tech. So, as you can see here on the screen, we're going to talk a bit about blockchain based electronic health records, or EMARs. You might be used to that abbreviation in case you're in nursing, like the medical record where you're actually administering medicine. Also, there's different entities that are already actively storing personal health records on the blockchain. I also want to talk about some decentralized clinical trials and some health data marketplaces. Each of these things are all powered by decentralization, and most of them incorporate blockchain technology. Uh, and in case we don't get time to go over it, the main thing I want to emphasize, people always ask me, what's a skill, what's a career that I can go into? I would say UX UI. UX UI is an invaluable skill inside of the job market. UX UI is literally making things aesthetically pleasing for people who are going to use whatever product or service there is. So definitely look into that, but we'll chat a bit more about that at the end if I have a bit of time to go over that. So I like to practically take people to these things. So the first thing we're going to talk about is a blockchain based electronic health record. So this is a great website that you can check out. Most people are familiar with MIT as a college. So MIT actually has been utilizing and studying how to put this sort of data on the blockchain for well over 5 years now. Hopefully you can see the URL up here at the top of my screen. This would be a great place to come and see how an entity that actually has funding has been utilizing blockchain to document electronic health records. So I think this will be one of the first and most practical ways that we can actually utilize blockchain technology as far as healthcare is concerned. Actually storing people's medical records on there. And you can do different things to make it password protected, um, and or safe from the general public having access to your records. But just the fact that it'll be accessible and documented on blockchain technology, meaning that it can't be edited. It's never going to go away. If your house burns down, you won't lose it. It's definitively going to be stored somewhere. That's a great place to start. So again, this is media.mit.edu, and the name of the project is called MedRec. It officially went live in September 2018, or sorry, January 2018, as you can see. But this is a great case study and a great use case here. The next concept I want to talk to you about are personal health records on the blockchain. So this one over here, I actually was just on panel with a gentleman today, Tambet Artem. In fact, that's why I have my LinkedIn up just to show you a picture of him. He's a gentleman, the second from the left. He works for the Estonian government, and they actually have been utilizing blockchain in Estonia for well over a decade now. And it's a symbiotic relationship between the government and the people. So if you, as the end user, you're like, okay, my driver's license is on here, my health records are on here, what benefit is it of to me? Well, every time the government or any entity accesses your information, not only is the instance that they touched your information documented, but it's easily contactable to find out, like, okay, you wanted to see my driver's license. Why? They have to tell you why they need your data. This isn't like people can resell your data and solicit to you. Like, they actually have to be using it for an official capacity. So that's a great project to check into. When I was talking with Tambet, the Estonian government is actually invited, I think it's Finland and a few other entities, Czech Republic. There's large governments that are actively using blockchain technology right now to document individuals' personal data. Everything from death certificates, birth certificates, driver's license, marriage certificates, everything. This is happening actively now with over a decade of actual use in progress. Another country that's actively using blockchain technology, you want to check into Ethiopia. They deployed a blockchain based system for their students. So they put over 5 million students' school records and grades onto the blockchain. I think they did a partnership with Cardano and Charles Hoskinson, and that's been live for at least 2.5 years now. So when I'm bringing up these practical examples of how it's being utilized, because I want people to know these aren't just fairy tale concepts. Like there's actual government entities, actual countries, actual private businesses that are utilizing this technology. So I'll pause there and say that to say that means there's individuals that need to be working inside of these different roles. So there's going to be somebody who's actually helping to build the code. Yes, that's the first thing that people think of when they think of blockchain. Like, okay, I need to learn coding. It doesn't stop there though. You also have to have clerical people, you have to have salespeople, you have to have front leading people who can explain this technology to the end user. Your grandma has to update her information on this blockchain, so somebody needs to be able to explain that to her. That would be a customer success or a customer service individual. So when we're talking about rolling out an entire entity or an entire system, such as deploying a blockchain, there will actually be a huge demand on us as well, us as the citizens, because we would need to make sure it's deployed equitably and safely. The next example that I wanted to show you was the decentralized clinical trials. This is super cool. I actually did an internal talk for Consensus for Black History Month. The ERG reached out to me and asked me to do a Web3 talk, so that was really cool. But Intel has partnered with Consensus and they're actively using blockchain technology inside of their clinical trials. So, this is a great website, or you can just Google Consensus blockchain clinical trial and it should pop right up. So, this is heavily documented. This was done in August 2021. So, basically, all of the data, all of the conclusions, the entire trial from start to finish is all documented on the blockchain, easily accessible for anybody. The shorthand URL is hu-manity.co, humanity.co. And it was during the pandemic that this was really born of necessity. So literally they were able to keep track of how many patients vectorized, what countries became hotbeds, where were vaccines deployed. It's a really great uh, exploration of, even in a pandemic, you can really utilize blockchain technology to track things that are happening in real time. Again, you need people that are not just coding and data savvy, you need the laboratory specialists, you need the researchers, you need the nurses, the doctors who are running the clinical trials to be very meticulous with how they're logging this data in real time. So again, this is a great clinical trial to check out. I know we only have 20 minutes and I would love to like dive into this and nerd out with you, but I at least want to get some different items in front of you so you can do some research on your own. So then the next thing that I want to talk about is a health data marketplace. So a great place to look for that as well is here on Humanity as well. Sorry, they got a little pop-up ad down here. They say, we believe that your data is your property. So this is open source health data marketplace, right? So when you come here and you scroll down, this is powered, they have a lot of different community partners. This is powered by Deloitte and it's specifically their ethical technology and trust department. And sorry, just a minute. And then also, sorry, I'm like at a conference actively. I just got done speaking here at the GBA. So I'm like, I'm really squirreling around here with all these different conferences. But I'm really excited to be here with you and sharing this information today. But Humanity is a great place to come and check into an open source data software. Um, so I'm going to flip back over here just for a minute. If you want to get in contact with me, you can reach out to me on LinkedIn. You can just look up Alana Whitaker. That's my name. And then I'll be able to chat with you in the private chat. So, questions? Any questions here? I'm going to stop presenting. Sorry, they're like trying to get in my room. Mm-hmm. Any questions? There we go. Sorry about that, y'all. Okay. If not, let's see. I see in the private chat here. She says she's having some technical issues. No worries. Well, Another note that I will say is that uh, some of the roles that you can look into when you're considering getting into this industry is learning different coding languages. And I want to re-emphasize that because at minimum, if you do want to know how to interact with some of these blockchains or learn how to build out some of these products and projects, it is good to have a baseline in that. Some good languages to know might be JavaScript. It's a great foundational coding language to know because it's the basis of Python, it's the basis of React, it's the basis of Rust. And those three languages are probably three of the most heavily utilized right now as far as ideation inside of blockchain technology. Um, if you're looking for different resources on how to learn that. There's actually a lot of free resources online. If you want a more formal training, I would look for boot camps. Boot camps, in my opinion, are a little bit more efficient than, say, a traditional legacy college institution. The legacy college institutions are trying to catch up to boot camps, but I feel like boot camps just deliver it better. They're very curated with their information, they're very quick. Um, and they deliver the information succinctly, typically in 8 to 12 weeks. One institution that I had a partnership with earlier this year is Brain Station, which is down in Miami. And they do cohorts all the time teaching people the basics of these languages. Um, Additionally, I would say learnweb3.io is a pretty good free resource. It teaches you about the basics of coding languages, how to start iterating and ideating in Web3, and how to build out inside of that space. Um, Also, you can tap into my business. What am I doing? Blue Collar to the Blockchain. We host in person social activations and events where people can come and test out different Web3 concepts, whether it's XR, VR, AR. Um, I host Web3 hackathons. In addition to that, I'll connect people to community resources as far as learning how to code and things of that nature. Um, but I will say my first exposure to tech was through nursing. All 13 years that I did nursing, I probably put every type of device inside of the human body possible. uh, I feel like now in this journey, I've been away from the bedside since September 2020. And I spent a great deal of time talking to individuals about Web3 concepts, making blockchain accessible to individuals. And people are curious about it, they're deeply curious about it. But what would make it more accessible is open source information as far as learning the basics of it in a safe and reputable manner. I feel like there's so much information online, people don't know where to start. And I feel like the jargon is too large and too wordy for the average person to get. So I like to spend a great deal of my time breaking things down to the average everyday layperson. Um, oh, okay. That's just the little banner pop up on it. So as far as filling the workforce shortage, I know myself and some of my colleagues stepped away from the bedside due to burnout, right? And when it comes to trying to replace some of the workforce, what we need to be doing instead is streamlining the work that we're tasked to do at the bedside. Um, I feel like a lot of that can be handled. There's a few different healthcare institutions up north that I feel like are doing this very well, and I'm exploring relationships with them right now, so I sort of can't mention names. But what I will say, they are typically more forward thinking when it comes to utilizing alternative technologies, not only to train healthcare workers when they're not able to physically be inside of the hospital, but they're also more forward thinking when it comes to allowing the staff to take the charge on using different types of technology to help make work easier. For example, I know when I first started working early in my career, my home hospital was Mayo Clinic. And at that time, we it was common for surgeons to have remote calls with surgeons around the world when it was a specialized case or when they were unaware of how to do a very specific procedure. And we take that for granted too. Back in the day, you had to hop on a plane or a boat and fly halfway across the world, sail halfway across the world to meet up with experts. But now you can hop on a video call and have an expert in your pocket immediately. There are so many different types of technology that we already utilize right now inside of the healthcare space. There's a program out called Hollow Anatomy where they're actively training doctors and nurses inside of XR now. And there, I think there's been two iterations of classes that have graduated from utilizing that technology. In addition to that, uh, I know since I started doing ACLS training, because I have ACLS training because I was in the ICU, and I've probably renewed my ACLS, I don't know, 6 times, because what, a 2 year license, so 6 or 7 times over the 13 years. They've really gotten better with simulations and training when it comes to teaching people about advanced cardiac life support. So this is where they'll put different modules and simulations of dummies up on the screens, and now they utilize a lot of AR and VR at the bedside as far as training with ACLS. So I'm looking to go back. I could share my screen on that again, but there's an open innovation center in my hometown that's exploring new types of tech. In addition to that, um, there is a what do you want to call it? It's an innovation lab at Mayo Clinic in Jacksonville, Florida, as well, that I'm exploring as well. So I say all that to say these larger entities are investing money and investigating these new types of technology. So if you want to still be at the bedside, consider exploring some of those departments. If you're considering breaking into healthcare, already start looking at roles that are taking this new type of tech into consideration. If you're considering leaving the bedside and you're thinking it's burnout due to a staffing shortage, poor unit management, things of that nature, consider advocating or lobbying for using some of these types of tech to help streamline or automate things. 1 minute to wrap up. Um, well, in a nutshell, I'll say that health tech is probably where most of the dollars are going to go when it comes to where we're going to go in Web3 and automation. And I'm super excited about that. I'm actively investigating that intersection now, personally, myself. And I'm grateful to have the experience behind me that I do have, because it makes it much easier for me when I'm advocating for these types of tech. Connect with me on LinkedIn. You can find me on Instagram at Afro Butterfly. And I'm very grateful for you allowing me to share my knowledge with you today. And I've learned a lot from the other panelists as well. Hope to see you on different sessions. Thank you.